you know, I've seen a lot of, you know, I've been up to Canada. I've seen what state-run healthcare looks like. In a lot of ways, it's very nice. It's very pretty. In a lot of ways, there's a lot of rationing. How far do we want to go? How far? What is your ideal system?
My ideal system would be a basic level of insurance care for everybody that we all pay into one pot. And
single payer.
Yeah, it's a single payer, like a Medicare for all, probably. And then above that, you get private insurance, whatever you want. I mean, so people would have insurance packages through their employer. Employers would offer them to entice people. You could get it on your own. But there'd be a basic level, transportable. Small businesses wouldn't need to worry about it, and we'd pay for it, you know, in a fair way.
If this passes, and we, I think it leads towards rationing at some point, as happens in Canada. I went up, I met the people in Canada, I've talked to the people who waited on waiting lists for simple operations like a hip replacement, and it's sad. I think we've seen a lot of people in Canada who have escaped down south to have a lot of these operations that they can't have. In fact, if you've watched this program, which I know you do weekly and regularly, we've met a few of those folks. Will people be leaving the United States going someplace else? Will medical tourism become a bigger business?
We have rationing today in this country. So, I mean, it's your insurance company that rations you. You can't waltz in and say, I want this, I want that. It's all up to a insurance company, actually, as it will be after this bill passes, by the way. I mean, there's no...
It's up to a contract that
right.
I sign and an insurance company
And that doesn't
signs.
change after this current health care bill goes forward.
So it's not like this is an evil company. These are two parties who have made an agreement. I'll give you this much money, you cover these things. And if you're in violation, I sue you. That's the right use of lawyers. So,
but that'll be the same the day after this passes as the day before. I mean, we're not interfering with contracts between individuals and their insurers.
But you're telling me what I have to contract and what I have to purchase.
No, there's simply, if you don't want to be insured, it simply says there's either going to be a 2.5% income tax or a $750 penalty. So you're not forcing other taxpayers
so
to pay for you.
You are compelling me to either be insured or pay a penalty.
We're removing the gun from your head that every day is forcing you to pay for people who choose to be uninsured, John. I'm not sure. Why are you outraged about this?
For the third time here, Mr. Congressman,
can't
you take care of that mandate before? Now,
well, that's what you should be talking about.
These mandates started with the federal government, that employees have to be covered by health care. This started in World War II, the famous ruling by the IRS in 1945 that's saying, yes, you can use pre-tax dollars if you buy through your benefits plan as an employer.
In the grand scheme of things, what would make sense is to move away from the employer-based model.
I agree. Does this do any of that?
Yes. If we can keep the excise tax that's in the Senate version, what it does is above a certain level of insurance, $22,000, $23,000 a year for a family, you basically have to use after-tax money rather than pre-tax money. What it says is there's a 40% tax on the amount above $22,000. That's about the marginal rate, 39.6.
Let me ask you about medical tourism, only because there was a Denver Post article that said you have a substantial investment in Bridge Health, I believe it's called, which is a medical tourism company that sends people from the United States for medical treatment in countries outside. Now, I got to wonder, why would you invest in this company if you think that our system here is going to be getting better?
Well, again, this is investment from several years ago, so it doesn't. I mean, I know that there was somebody at the Independence Institute recently wrote something about it a couple months ago. Took a look at it and said that according to your finance statements, you've got between $1 million to $5 million. But what he tried to do is he tried to say it had something to do like with this healthcare debate and where I thought healthcare was going, but what he didn't realize is this is an investment from, I don't know, 3 years ago, whatever it is. It's well before Obama was even elected, so it is. Obviously, it's not a bet on where healthcare is going under Obama. It was something from a couple of years ago. It's something that makes sense, and I can pitch it. I mean, basically, mostly it's elective surgery, so stuff that's not covered by insurance. But people who want, facelifts or even more expensive elective procedures, they can be done at a fraction of the cost in India and Mexico. Well, there's a lot of overhead associated with doing business in the United States. It's some of the same reasons that American jobs are being lost overseas, whether it's everything from real estate to taxes to government regulations. In
those countries that on the company that you've invested in, they send them to countries in South America.
Well,
and
nobody
India.
gets sent anywhere. An individual chooses. I want to go to India to get my facelift because it's cheaper than getting it in
Do any of those customers of yours go to Canada or the UK or any of these other single-payer countries?
I wouldn't know, John, because I'm not actually involved in the business. No, all I remember, because this is from a couple of years ago, is that the main countries that receive patients are Mexico and India. Beyond that, I'm not an expert, and I don't pretend to be on that. So.
Well, do you think there'll be more medical tourism after Obamacare passes?
I don't think so. Again, it's generally self-pay things that aren't covered by insurance. So I mean, it's things that people can't get. If you have insurance, this is part of the problem with insurance. You don't care how much something costs. If you're insured, I mean, and you need it, you could care less. You're not price sensitive, and so there's a little bit of a principal agent kind of moral hazard problem with that. This is for procedures where people are price sensitive, and they're ones that are generally not covered by insurance.
And those things have gone down, where we have people buying in cash, looking in their own wallet. You look at cosmetic surgery, you look at LASIK, and the innovations continue to increase. The costs keep going down. The competition and availability. You know, I haven't heard too many people advertising for OBGYN services, but I sure hear a lot of LASIK guys on late night radio. All right,
I don't know if I want to pay $299 for LASIK. I'd probably rather pay the $800 because I worry about the guy doing it for $299.
But that's your choice.
Yeah.
And Americans are great consumers.
Yeah.
That's why I want to have more choice and less regulation. Give me an idea where you think this is. We've got a couple minutes left. You got the House bill, you've got the Senate bill. First of all, let me talk about transparency. I was encouraged that Obama said we're going to do this in front of C-SPAN cameras. That turns out to be a pretty blatant lie. This is not being done in front of cameras. Who came to the White House wasn't done, and now the conference committee isn't going to be done in front of the C-SPAN cameras. Your comment on that first. Why hide it?
You know, I'm always for transparency and openness. Frankly, what I've talked about doing, I might actually move forward with something like this. As you know, in Colorado, we have a sunshine law, probably something you opposed at the time, but something I think is good.
Loved it, great.
I would like to see something like that at the federal level. We should have the same openness and transparency. People want that and expect that of their government.
And it's a shame, and I would, let me applaud you on that. I think if it's good for Colorado, it's good for America. Government shouldn't be done in Harry Reid's office with a senator from Nebraska. What do you think is going to happen? You got the Senate, you got the House. I think quite obviously it looks like they're going to try to do the Senate perhaps without even a conference committee. So tell me, will there be a conference committee? What's going to come out?
Well, we had a call on our Democratic caucus the other day with the Speaker just yesterday. She talked about what I think we're going to do is it's a process where we will work out some of the differences between the two bills, and we will do it through a process that's not formally a conference process, but it means the entire House will accept the Senate bill and then add some amendments to it and send it back to the Senate, who will then have to approve it as amended. It's called ping pong, and it could theoretically come back to the House if the Senate then changes it again. We've used
so unlike having a conference committee report that cannot be amended, you send something that could be amended.
That's exactly, yeah.
So does it pass?
Yeah, I think so. Again, you know, it's hard to look into a crystal ball, but I think probably by end of January, early February, there will be a bill sent to President Obama.
A few seconds left. Let me say this: you were one of the, here in Colorado, there's a lot of town hall meetings. You jumped on them. You never went back. You held 30 of them. I want to thank you for listening to your constituents. You've always been a really accessible guy, and when I beat you in the next election, it's nothing personal.
Welcome to the race, Sean. You know, we originally had 12 town hall meetings scheduled, and then there was such demand, we increased it over 30.
Let's do more. Jared, it's always good to see you, and we'll see you next week. Tell a friend right here on KBDI Channel 12.
I mean, you keep on talking, but you don't know where to turn it off.